Good afternoon, everyone. My name is Christine Malhart. I'm the Director of Communications and Public Affairs for Blue Shield of California Foundation, and I am happy to welcome you all to our webinar this afternoon announcing our new strategic plan. So as many of you know, we've been really busy at the Foundation for the last few months, and today's webinar is we're here to share with you additional details about our strategic plan that we revealed earlier this year. So I'm sure many of you on the webinar today have seen our fantastic new website, and if you haven't, please humor me as the communications team leader who spent a lot of time on it, and go check it out right now, and you can learn more about the initiatives that we launched with our new strategic plan in January, and find out more about our grant-making focus areas. Today on our call, you will hear from Peter Long, our President and CEO of the Foundation, as well as our three Senior Program Officers, Lucia Corral Pena, Carolyn Wang Kong, and Rachel Wick. We'll talk about why we decided to make a shift in direction, what it means for you, and what it means for the Foundation. We'll also provide information on our three new grant-making initiatives and what we hope to accomplish with all of this great work. So I will now turn it over to Peter Long, and as usual in webinars, if you have any questions, please enter them into the chat box as you go, and we're going to reserve Q&A until the end of the webinar. Peter, over to you.
Great. Thank you, Christine, and welcome everyone. For nearly 2 decades, the Foundation has been working to improve the lives of all Californians. Our mission to build lasting and equitable solutions to make California the healthiest state and to end domestic violence has guided our work throughout. We have made great strides in strengthening California's healthcare safety net and in making it easier for our state's most vulnerable residents to get access to high-quality care, leading to coverage rates in the state reaching their highest levels in history. We also dramatically increased access to domestic violence services, specialty care, and behavioral health and substance use services. In carrying out this strategy, we have learned a great deal from our work and from our partners, and have many success stories to share. However, as we look at our world and the increasingly complex challenges we face, it is clear that in addition to meeting the most immediate and pressing needs of our vulnerable residents, we also need to create new kinds of solutions and introduce new approaches. Next. I want to share the 4 values that guide our work. Integrity means that we are trustworthy stewards of our resources, and we can be counted on to do the right thing to advance our charitable mission. Partnership means we are committed and thoughtful ally who works to understand the needs and aspirations of our partners and intended beneficiaries. When we lead, we do so with humility and empathy. We seek out new ideas and embrace experimentation, make informed choices, and act courageously to live our value of possibility. Finally, we will bring the voices and experiences of those at the margin to the forefront of our work and believe that doing so will enable all Californians to live to their full potential by being healthy, productive, and free from violence. In 2016, Blue Shield of California Foundation took the first steps on a journey that would have dramatic implications for our work and impact. Over the prior 6 years, we had achieved considerable success in our work to expand access to high-quality health care and to end domestic violence in California. Through our funding and support, we shaped the creation of healthcare services that better engage low-income patients and domestic violence services that took into account the experience of survivors. We demonstrated how to integrate disparate healthcare services such as primary care and specialty care and behavioral health and primary care to improve access and quality while potentially lowering cost. We created networks of established leaders within the healthcare and domestic violence safety nets in California and influenced safety net systems in California to think and act differently. As our previous plan was wrapping up, we began to ask ourselves whether there might be new ways to promote the well-being of individual Californians, who in many cases were receiving services from both fields where we've been working to build and support. As we embarked on our strategic planning process, we began talking to our grantees about their successes and the challenges they were still experiencing. We reflected on what we as a foundation did well and where we could have an impact. We talked to experts in the field to hear their thoughts on future pathways. Ultimately, we decided the most impactful path forward for our foundation was to fundamentally shift our approach to address the root causes of poor health and violence. And we did so boldly, not just by 1 degree or 2, in an effort to move closer to the source of the issues that matter to us most, improving the health and well-being of the most vulnerable Californians and ending domestic violence. We did so because we believe that successful upstream investments can influence outcomes for health and domestic violence and be sustainable for the long term. A growing body of literature tells us that 80% of what influences a person's health and well-being happens outside of the healthcare system. Things like access to affordable housing, availability of good schools, exposure to violence, personal health habits, and personal and community supports. This information is not new. For decades, awareness of social determinants of health and the impact that these determinants have on overall health and well-being have been well understood. Despite this knowledge, the preponderance of our funding has nonetheless remained focused on the healthcare system. We also know that domestic violence has its own determinants. Things like harmful norms and culture, weak social networks and low trust, weak community sanctions against domestic violence, harmful media and marketing practices, housing insecurity, and economic insecurity. To address all of these factors, we have shifted our strategic direction to ensure that our work transforms the health and well-being of all Californians. We've set the bold goal of California becoming the healthiest state in the nation with the lowest rates of domestic violence. And all of our work is now directed toward accomplishing that goal. Our new strategy expands our focus to look at the many factors that influence health and well-being and to develop new approaches, collaborations, and solutions to achieve our bold goal. We have identified our first 3 initiatives that will help us get at the root causes of health, well-being, and domestic violence, as well as the interactions among people, families, and the systems that serve them. The first initiative is breaking the cycle of domestic violence. The second is inspiring and enabling collaborations to bring together various sectors, systems, and people. And the third is designing breakthrough models to create health and well-being. We know this work cannot be done alone. Within these 3 initiatives, we will engage new partners from many different sectors to collaborate with us. We will promote equity in our communities, and we will examine what produces health and well-being, especially for those who face the most adversity and have the least support. Many of you are with us today because you share our values of partnership, equity, possibility, and integrity. I cannot wait to see what we will accomplish when we come together to collaborate for significant and sustainable changes. I'm now going to turn the call over to our 3 senior program officers from the Foundation who are leading these new initiatives. Lucia Caral-Peña, who is leading Breaking the Cycle of Domestic Violence, Carolyn Wang Kong, who is leading Collaborating for Healthy Communities, and Rachel Wick, who is leading Designing the Future of Health. Lucia.
Thank you, Peter. Many of you on the line know that the impact of domestic violence on our nation and the state of California runs very deep. 1 in 3 women will experience intimate partner violence in their lifetime. A survey that we commissioned recently showed 58% of Californians have been touched by domestic violence, either as a victim, as an abuser themselves, or through a close friend or family member. The Foundation has made significant investments in the domestic violence field to date. Our total investment is more than $99 million. Our support has helped families impacted by domestic violence take care of their immediate needs for health and safety, has provided an integrated care pilot on health and wellness for domestic violence survivors, informed policy work at the state and national level, and transformed our role in the field beyond funder to partner, collaborator, co-creator, and ally. Over the past 16 years, our work in domestic violence has focused mainly on building the services, organizational, and leadership capacity of the domestic violence field to meet the needs of survivors. Our emphasis has mirrored the domestic violence sector. However, Over the past few years, we've also invested in a few innovations for prevention and early intervention that are informing our shift to address the root causes of domestic violence, with the goal of ultimately ending the cycle of domestic violence in California. While the safety net remains essential, we recognize that deeper investment in prevention will allow us and others to disrupt the domestic violence pipeline. Our new direction will have healing and prevention as core components to address the needs of families and to address the adverse impacts of exposure to violence in childhood, adolescence, and early adulthood. We know that domestic violence often starts with early exposure to family violence and or child abuse, and that additional risk factors come into play during adolescence and continue through early adulthood. And we know that each of these stages will require unique solutions for prevention. We also know that the complexity of this issue demands a diverse, collaborative approach to breaking this cycle at different stages of life. A broad array of partners across the state is needed in order to make meaningful progress. And to do that, we need to identify and engage new partners and redesign how we work with our current partners. We are asking ourselves questions that we didn't ask before. Questions like, what are the root causes of domestic violence? And what is the Foundation's role in addressing these root causes? We've taken a deeper look into the data on rates of domestic violence, its prevalence, and key contributing factors. But we know this paints an incomplete picture of the issue. The information is often outdated, and there are broad gaps and inconsistencies, particularly among people and communities facing multiple forms of adversity. What we've learned boils down to one key concept. In order to end domestic violence, we have to stop it before it starts. To that end, we will work to promote healing and prevent the harmful and lasting effects of domestic violence at multiple points along an individual's lifespan. We will do this by reducing exposure to domestic violence by supporting early identification tools, prevention programs, and practices that help children most at risk. We will invest in preventing relationship violence through youth engagement models, adolescent resiliency strategies, peer-to-peer support programs, and similar types of interventions. Focusing on community and family-based approaches to address and prevent domestic violence, leveraging gender-specific strategies, collaborations, and coalitions. We will also identify opportunities to generate public awareness and new policies that can help us transform gender violence norms and reduce prevailing stigmas. To do this, we see need for early investments in the following ways. We will be expanding to engage new partners and funders to end domestic violence. We will seek to invest in better data that addresses critical information gaps. We will invest in more collaborations that bring together a variety of interests and sectors throughout the state, and more advocates in communities with high rates of domestic violence to inform and lead policymaking and public prevention efforts. Most importantly, we will prioritize lived experience to drive new solutions. Currently, we have opportunity under this new initiative for which we have recently accepted applications. The Reimagine Design Lab, which is designed not only to inform domestic violence prevention program, but also to co-create new solutions directly from the field, leaders and influencers working both inside and outside the field. We have also embarked on a root cause analysis to domestic violence by our partners, Forward Change. This team is developing a life course framework with us to help frame our analysis and identify a range of interventions from proven to promising to reduce the incidence of domestic violence, particularly for low-income communities of color,
by interrupting the enduring intergenerational patterns of violence within families that impact all of our communities. We expect to be announcing additional funding opportunities in the next few months. We are hopeful that this new direction will help us generate the lasting change we so desperately need. I am now going to turn the call over to Carolyn Wang Kong to provide further information on our Collaborating for Healthy Communities initiative. Carolyn?
Thank you, Lucia. So we know that many of today's collaborations within communities have been built around an initial partnership or relationship really between two organizations, and that these collaborations are the result of years and sometimes decades of hard work across the organizations to build trust, accountability, and agreement around shared outcomes. However, many cross-sector and cross-system partnerships are still focused on a limited service delivery scope. They're designed to respond to a specific need for a specific population. Oftentimes, these are also funded with short-term grants, which forces a focus on demonstrating short-term measurable outcomes rather than encouraging attention to strategies that address the long-term prevention. We've started to learn about transformational collaboration through the Foundation's support of the California Accountable Communities for Health Initiative, or CACHI. CACHI is an effort that's helping 15 communities across the state address their most pressing health issues, ranging from creating a heart attack and stroke-free community in San Diego to improving asthma support for children in Imperial County. From this early work, we've come to believe that in order to sustainably transform the health and safety of communities, collaborations must have their eye on the long game towards prevention. To do so, collaborations must involve multiple players, both inside and outside of healthcare, who can make change in their own sectors and also across systems. We also believe that collaborations should center on the wants of those most impacted by the issues, and that community engagement goes beyond checking a box or providing one seat at the table. Lastly, we believe that in order for complex change to occur, it has to be funded differently. Transformation doesn't take place in a year or two, and funding for these efforts must come from both public and private sectors in order for change to be supported and sustained. We know these changes won't necessarily be easy. We understand that moving to the right of this continuum requires that we collaborate beyond partnerships and that we shift from the transactional to the relational, and that we hold ourselves accountable for shared outcomes rather than those that may only serve our own interests. But we believe that if we're successful, these collaborations will serve as a vehicle for communities to tackle a range of deep-rooted, complex issues and drive toward a community-defined vision of health and well-being. Based on our learning to date, we've evolved our thinking about both the sophistication and also the nature of effective collaboration, and we see some distinct opportunities to use this approach to create the transformative change that our state needs. So first, being intentional about setting the table for collaboration. Liftoff of collaboratives can take time as new partners are brought into the relationship and trust is being built. If we're actually intentional about setting the table for collaboration, meaning that we hone in on the most resonant community priorities, we engage partners who can inform and influence those priorities, we develop shared outcomes to focus on, and we build trust and shared commitments around those outcomes, the chances of that collaborative being able to make lasting change is increased. The second opportunity we see is around authentically engaging community so that collaborations are focused on the needs and wants of those most impacted. There's wide variation in what community engagement can look like, ranging from a community survey to actually co-designing interventions with residents. And we know that if we center the work on the desires of those most impacted, doing with and not doing to, the resulting strategies and outcomes will be more relevant and effective. Third, exploring and testing self-sustaining funding models that engage support from both the public and the private sector. Short-term funding often drives collaboratives to focus on short-term outcomes, but prevention is a long game. We know that if collaboratives are to be effective in transforming their communities, then funding models will need to be designed to really incentivize prevention and be flexible so that collaboratives can be responsive to unique community priorities. Lastly, testing and spreading collaboration as an approach to break the cycle of domestic violence. As you heard from both Lucia and Peter, the drivers of domestic violence are varied and complex,
which means that the opportunity for prevention is one that is influenced by many sectors. We see tremendous opportunity in harnessing the power of those sectors to work collaboratively to mitigate the host of drivers of domestic violence. As part of our Collaborating for Healthy Communities initiative, we will shift from investments in collaborative dyads to investments designed to support transformational collaborations equipped to address complex social drivers. Specifically, we plan to focus on identifying the fundamental elements that allow collaborations to thrive, including promoting authentic and meaningful community engagement, improving how we set the table for collaboration so it can be effective, and preparing new organizations to enter into collaboration. Lastly, we will plan to seed new collaborations designed to improve health and prevent domestic violence. Through our new funding opportunities, we hope to learn how to design, support, and scale collaborations to address multiple social issues and empower communities, to learn about the role and the division of public and private sector support so that we can actually sustain community-led collaborations. And lastly, we hope to gain a better understanding of how models like CATCHI can be breakthrough models for disrupting the cycle of domestic violence and curtailing the multiple drivers of poor health. We believe that collaborations that are truly integrated will be uniquely positioned to improve health and reduce violence in California communities, particularly for our most vulnerable neighbors. So please continue to check our website, sign up for our newsletter. It'll be a great way to stay in the know on opportunities that we're hoping to release in the next few months. So now I'm going to turn the call over to Rachel Wick to provide further information on our Designing the Future of Health initiative. Rachel?
Thank you, Carolyn. We all know that we are living in a time of unprecedented change on many fronts: technological, political, demographic. We are also learning that this change is only predicted to continue or intensify over the next 10 years. At the same time, we're confronting the harmful impacts of long-term negative trends related to the root causes of poor health. These include income inequality, violence, the affordable housing crisis, concentrated poverty, and racism. But what's exciting is that we also know more than ever about what it takes to create health and end violence. And there is a deep sense that we can't keep doing our work the same way to achieve the kind of change we want. People and communities are complex. Social change is complex. And our solutions have to match that complexity. In our Designing the Future of Health initiative, we want to think about what it will really take to solve these challenges and to generate breakthrough solutions that could set us on a path to health and well-being. We want to shift from approaches that address individual drivers of poor health and violence to approaches that consider multiple complex drivers. We want to shift from funding near-term interventions to approaches that reward investment in long-term solutions. We want to build on existing practices and frameworks for health and violence prevention, while also drawing on new ideas, new partners, and new pathways to accelerate and sustain change over time. And above all, we want to be creative and imagine what could be. In this initiative, we will seek to understand what the future will hold and how California can anticipate early and adapt to the changes that we see coming, and actually embrace them as opportunities to produce health, end violence, and promote equity in communities. One trend we are looking at right now is the future of work and its implications for health and security. We know our economy is rapidly changing, with many more workers on the gig, fewer jobs guaranteeing hours, providing living wages and benefits. What does this mean for families' health, well-being, and economic security? What should we be doing now to adapt to this new reality? We are also really excited to experiment with new tools that could match the complexity of the problems that we're trying to solve. For example, we're learning from our partners in the environmental field about human ecosystems. Ecosystems focus on the dynamic interactions between people, institutions, and the environment. They seek to understand the flows of activities and resources, the way feedback loops or responses between systems happen. Ecosystems are also resilient and self-sustaining, and we think they could match the complexity of the problems that we're trying to solve. We're exploring the possibility of applying them to our efforts to improve community health and well-being and end violence. Finally, we know there aren't many incentives today to invest in things that will generate positive outcomes for health and well-being in the future. Later this week, we will release a new request for proposals on exploring the value of prevention. We are looking for partners and projects that can help generate new ways of defining and measuring the value of investments that produce health and well-being and end violence. This could include research, policy development, testing new models in the field, and building the belief and will that investing today for outcomes in the future is critical. We want to grow sustainable investments in what works and what communities want, like the strategies outlined by my colleagues, Lucia and Carolyn. There are many ways to approach this challenge, and we are looking for your best ideas. And if we can figure out how to generate long-term sustainable investments in prevention, we will have made a real impact on the future of health. I'm now going to turn the call over to Christine Malhart as we transition to the question and answer portion of the webinar. Christine?
Thank you, Rachel. Great. And please, as I mentioned before, if you have questions you'd like to submit for our presenters, please put them in the chat box, and we will do our best to get to all the questions before we wrap up today. Before I get to question and answer, I want to give a quick overview of what we're thinking about next, which is our learning and measurement approach to this very ambitious plan. So the short story is it's a work in progress, and this is something we've been spending a lot of time on over the last few months to really determine how we are going to learn as we go in a way that really aligns with our values and allows us to show progress towards our bold goal. So as we get into this plan, this is what we're going to be doing, is really thinking about what meaningful measures we can come up with that will track our progress towards our bold goal, and do so in a way that really allows us to live true to our values. So with that, I'm going to get us started on our question and answer portion. So again, please put any questions you have in our chat box. We've seeded a couple questions here for you to ponder and think about, and as you're listening to the question and answer, and if you want to share these with us via email or social media, these are things that we're really excited to hear from you all as well. But our first question I'm going to give to Peter Long, and there was a question that came in that is, what does upstream mean?
So upstream is a term that describes, so it's contrasted to downstream, which would be often the prevention of services and seeing a set of circumstances, whether it's around domestic violence or in health, a set of characteristics that happen later in life. Upstream refers to all of the things that happened before. So something that happened, maybe exposure to violence in early childhood or observing violence, could later in life show up as someone could show up as a perpetrator of violence or survivor of violence. So when we talk about moving upstream, we're trying to address the factors that influence a person's health and well-being later in their life. It is often used in connection with prevention and doing things that prevent something from happening, or in health promotion or promoting well-being. So that's, thank you for the jargon police out there. We will try to de-jargon all of our talk and say that this is about capturing things before they happen and looking at some of the causes of both health and violence.
Great. Thank you, Peter. Our next question, we're going to do a little more definitional work here, and I'm going to give this one to Lucia. Lucia, can you tell us what it means to prioritize lived experience? And can you also let folks know what our definition of domestic violence is, if it encompasses more than just physical violence? I'll start with the second question, which is yes, the definition of domestic violence encompasses physical violence, financial violence, emotional abuse, and let's see, and financial abuse. Actually, I think I said that. I'm missing a fourth. I'm sorry. But in addition to that, we're actually shifting and we're being much more inclusive as we shift toward prevention. And that's because we are trying to really embrace the vision of a root cause, which means that we will be broadening a definition that is more encompassing of a family violence approach as well. With respect to what does prioritize lived experience mean, lived experience means it means really consulting those who are most impacted. Those targeted by a prevention or intervention approach should be informed and ideally driving those solutions. What it does mean specifically is not asking 1 or 2 or 3 survivors or targeted population folks as to kind of what do they need. This is about restructuring the role that those who an intervention or prevention approach is targeting to be part of the solution that's being explored. And that could look a number of different ways. It could be having a role in informing the program design, informing the evaluation of an approach. It could be implementing an approach. An example here would be in the context of domestic violence in housing. If there was an effort to focus on addressing homelessness, then the experience of homeless domestic violence survivors and their families should be driving the solutions that that project is focusing on. And it is something that we would be very attentive to in our review of requests. Great, thank you, Lucia. All right, our next question here is for Carolyn. What are some of the different sectors that would collaborate to break the cycle of domestic violence?
Sure. So what I would say is that, from the research that we've supported in the past and that we've learned about so far, we know that the drivers of domestic violence are very broad. And so what I'll start with is saying that we are very open in terms of really learning more about the different sectors that do have a role in prevention. What we're working from in terms of our base of knowledge, though, it's really around, if you think about where we live, where we work, where we play, and where we receive care. All of those different 4 questions really drive you to the players that actually have a role in prevention. So Lucia just mentioned our DV housing. Housing is definitely a sector that we've done some work in and are interested in learning more about. But also there's other questions around, what's the role of community development, for example. Where we work could be around workforce, where we're employed, as well as the role of business. Where we connect and play can be around norms and what we're seeing in terms of the sports industry, entertainment, the faith community. And then, of course, where we receive care, which is where we've largely been so far in looking at really the role of healthcare and also domestic violence service organizations. So it's a pretty broad spectrum.
Great, thanks, Carolyn, and thanks everyone for submitting so many fantastic questions. We'll try to get to as many as we can, and those that we don't get to, we will make available in an FAQ document along with a copy of the presentation and the recording after today's webinar. Our next question is going to go to Rachel, and it has a couple parts. So this is about how does race and racism and other forms of discrimination play a part in the future of work? And then also, how will the foundation be looking at and funding income and wage inequality and poverty issues?
Thanks, Christine. I love that someone went to the heart of the issues and the challenges that we're grappling with here at the foundation. So both income inequality and racism are huge factors that we know that we can't ignore in the work that we're doing. We have to pay attention to and understand. And there are also issues that our foundation or any foundation is not going to be able to solve on its own. And so I want to just offer kind of 3 ways that I think we'll approach the challenge of how to work on these big issues. One that I hope we've communicated throughout is listening to communities. So the way that we're going to understand what role we can play is really first and foremost to listen to the communities that we're trying to serve. The second is to partner relentlessly with other foundations, governments, nonprofits, and advocates across the state who are already leading work in these two big areas. And finally, as a health foundation, we want to find places where we could add value. Maybe there are tables where health and the impact of these issues on health is not really being lifted up in kind of bigger conversations about economic inequality, mobility, and race and racism. So we want to figure out where can we be supportive and add value to tables that already exist.
Great. Thank you, Rachel. And we had another question come in on that. Rachel hit a little bit on it, but I'd love for Lucia to chime in on as well of what will the foundation put in place to get more input from those most impacted with lived experience?
Well, a couple of things. One is the Reimagine Lab that I mentioned earlier in the presentation is actually what we would call kind of the external participatory elements of our work going forward that we're really excited about is seeking input from different fields and different leaders and different community representatives. In this case, that particular body will be announcing it next week, actually, or later this week, and who's part of it. And that's an example of where we are trying to engage folks outside of our foundation to inform our strategy as it's emerging. And this is in part due to an intention of making sure that we are seeking input, expertise, new ideas from others, at the same time that we are listening to the data, looking at what we're listening to what we're hearing, looking at the data, and trying to do an internal synthesis on our own. And so there's a dance we're striking between the input that we're getting from external partners and from our own internal analysis. What I will say is that as our strategy unfolds, specifically reaching out to survivors will likely take a variety of forms, including redefining who those survivors are. So, for example, we have historically been in lockstep with the field around a survivor being a person who has been abused, who has been the victim of domestic violence. We are now looking at perhaps as children being survivors as well. So looking at trying to think about what a survivor input or lived experience would look like is actually expanding our own vision around what inputs we have to drive our next steps.
Great. Thanks, Lucia. We've had a couple of questions come in for Rachel about her RFP that she mentioned, and so I'm going to give her this chance to give a little infomercial about what folks might expect to see in the request for proposals that Rachel has coming out in the next couple weeks.
Thanks, Christine. I said the magic words, RFP, generated a lot of interest, which is fantastic. So the big question that we're trying to answer with this RFP is, what will it take to generate sustainable investments in strategies that produce health and well-being and end violence? And there's a couple gaps that we're trying to look at. One is we know that we need more investment in strategies that promote strong families, healthy relationships, and community health and well-being, and those that intervene on some of the risk factors that we've talked about today that could lead to poor health and violence. We also know that we need more investment in strategies that address the root causes of poor health, that reflect individual and cultural identity, and recognize these dynamic interactions that we've talked about between individuals, families, and community environments. There's a couple of kind of sticky issues that we're going to try to work on through the context of this RFP. One is, how do we define and measure value in ways that mirrors the complexity of the strategies that we need? So we know a lot of work goes on today demonstrating the impact of single interventions using really standard methodologies like cost-benefit or cost-effectiveness analysis. We know that communities' lives are way more complex, and there's often multiple interventions and strategies that need to happen simultaneously. So we're curious, where are the efforts happening today that are really addressing that complexity, the interrelation between investments and interventions and the outcomes needed to address change? We also want to work on issues like the wrong pockets problem. So we've talked today about multi-sector collaborations. What happens when you invest in one sector and it produces benefit in another? How do we really create the kinds of systems and structures that will capture value across sectors? And finally, we want to go straight on the issue of kind of belief and will and motivation. So we want to get data and evidence. We want to catalyze innovation. But what will it really take to change people's beliefs about the need to invest now when we know the outcomes won't happen till far in the future? Could be 5 years, could be 20 years. And who are the investors that are willing to invest in an outcome that's that far in the future? So again, we're really just trying to create questions here in this RFP, and we're really looking to you to really formulate the answers through the projects that you propose.
Great, thanks, Rachel. And we're getting questions in asking about how to find out about the RFP or make sure that you get it. And the best way to do that is to sign up for our email list on our website. So you can go to the Contact Us page, sign up for our email list, and we will be distributing that RFP and others far and wide. So get on there today. All right, the next question I'm going to give to Carolyn, and there was a question that came in about how to reduce the isolation of immigrants and refugees as a determinant of poor health and domestic violence, or how it could come into play with some of the prevention and collaboration activities that we're discussing.
Sure, thanks, Christine. Thanks for that question. So for the foundation, we started to make a number of investments specific to protecting immigrant communities last year, and really those investments were designed both around promoting health and really ensuring access to health services as well as domestic violence services as part of our Act Now Fund. And what we've had some very intentional discussions internally, I'll say, about really how this work continues to live in our new plan. And I think what we've really come to grapple with is that this is very much our new normal and part of the context that we're also doing this new work in. And so our intent is really, as we talk about, we make references to lived experience and community engagement and centering on the needs of those most impacted. That very much includes immigrants and refugees as well as we think about prevention. I think one of the things that's been really eye-opening for us is a lot of the investments we've made, particularly supporting trauma and mental health of immigrant communities and really seeing the role that trauma has had on these communities. It really has impacted their health, and it really does put many communities at more risk for violence. And so we're very much aware of that, and our approach is, what I will say is, rather than holding it as a separate population, if you will, really embedding it within our overall new plan and the work of it.
Thanks, Carolyn. The next question is for Lucia, and it's a question about what the research has revealed about the root causes of domestic violence. So Lucia, please educate us.
Great. Thank you, Christine. So there are a couple of sources that I'd like to encourage you all to take a look at. On our website, we have a report from the Prevention Institute that did a wonderful job of tracking community determinants of domestic violence with an equity lens. So that is one source that we're looking at. In addition, I signaled the life course framework that Forward Change is working with us on. We will be releasing that in the next month or so. But just a little, I'll offer a teaser, which is that what we are finding in terms of root cause is childhood exposure, not just as a witness of parental violence, but also as a victim of child abuse. And looking at those two factors along with exposure to violent peer networks as three pieces of data that I think that will be driving some of our prevention solutions. But I do also want to take a step back and say that we're looking at these community determinants and looking specifically at the California context. And some of what Rachel outlined about the context in which some of our communities are affected includes some of the barriers and determinants that are outlined in the Prevention Institute report, like their people, place, and equitable opportunity framing around harmful norms, as Peter mentioned, housing insecurity, and equitable opportunity. And I think a lot of that will connect to the diversity and inequity that we see both in the access to services that we've known for a while now. And that should actually touch across, as I think about the responses Carolyn and Rachel just gave, we should be able to reach a lot of the isolated immigrant and refugee populations, and we should be getting to some of the ecosystem elements that Rachel mentioned, particularly around determinants regarding equity and racism. All right, thank you, Lucia. I think we're going to, sorry, let me get the microphone over here. We're going to give this next question to Peter, and this is a question about how the policy environment may affect this plan. So how does the uncertainty around federal healthcare policy impact our ability to implement the new strategic plan?
Thank you, Christine. So we do live in a very fluid federal health policy environment, particularly around healthcare, but also around domestic violence. And so our approach is twofold. You can hear from our commentary and from our presentation today that we're forward-looking and that we are very much looking to create a different future with a different approach and different sets of solutions. At the same time, to the extent that the federal policy environment or the state policy environment has negative impacts or potentially negative implications to, reduce health or increase poor health or increase violence, we see the need to take action. So this plan, you'll see that we're both addressing those factors which produce poor health or the policy environment in the context that produce poor health or can increase violence in our communities here in California. And at the same time, we'll be very much focused on what are new solutions and different solutions that move us beyond the current debates. Because I think one thing that we've observed about the current healthcare debates are that they're limited, and they talk mostly around who's paying for a particular set of services. What we're very interested in the foundation is how do we produce health at the individual and community level. So we will be very conscious and following the federal environment and the state policy environment, and then responding both today, immediately, and then thinking about how we respond long-term under this plan.
Great. Thanks, Peter. Never a dull moment when it comes to policy. Rachel, the next question here is for you, and this is a question about how we might manage the balance or difference between evidence-based practices and lived experience in communities as we're thinking about our models.
This is a great example of the dynamic interactions I think that we are looking at in the ecosystem work. So first of all, we want to know everything we can about what exists in the evidence base. We'd be crazy not to look to what works in trying to understand what interventions we might want to support and what strategies we want to support. At the same time, we want to, as one of our partners says, interrogate that evidence and make sure that it's got the validity in the communities that we're serving in terms of race, ethnicity, gender, and all of that. So we care deeply about the evidence, we want to look to it, and we want to interrogate it and make sure that we're using it in the right way. At the same time, we want to talk to communities about what they know works, what their aspirations and assets are, and how do we really build from there and hopefully marry those aspirations with some of what we're seeing in the evidence, or use those experiences to actually try to shape the evidence. So if we know something's working, how could we bring the rigor and the investment in understanding the rigor of what's going on, what's successful in communities, and really shape the evidence base. So I think it's a both and we'll really want to understand how to really create, I think, a dynamic feedback loop between what communities want and what the evidence we have today is, and shape it for the future.
Great, thank you, Rachel. All right, and we're going to wrap it up with one last question, and thanks to all of you who have submitted questions. We will get responses out to these in the FAQ document. This question came in, and this is something that all of us here at the Foundation have very spirited conversations about quite a bit, is how do we measure the value of prevention? And that is one of the biggest questions that we are trying to address in this plan. So thank you for submitting that, and thank you for being along on the ride with us. For our last question, we're going to go to Carolyn, which is, what kinds of community partners are you looking to work with outside of the healthcare sector to address health?
Thank you, Christine. That's also a big question. So given that, there are lots of different factors that drive health and well-being, any host really of community partners, it leaves a very broad scope. We know also from some of the research that's been done and that Peter actually alluded to earlier, there's lots of drivers of health that we're aware of. Access to education, jobs, social supports, economic stability also plays a big role, community safety. I would actually offer that what we're most interested in are organizations that have the mindset of prevention. That really there are lots of different sectors involved, but what we're looking for mostly is really organizations that see that they have a role in prevention of poor health, even though they're not in the healthcare sector, and organizations and sectors that are interested in playing a leadership role in promoting good health despite not being in the health sector. So I would say that that's really the stretch that we're trying to make here is making sure that we know that the tent of players is a big one, and that the mindset of knowing your role in prevention and having that role is a critical first piece.
Great, thank you, Carolyn. All right, and thank you for all of those great questions. It's really great fodder to get our brains thinking, and as I said, we'll get the frequently asked questions document out to you in the next week or so. So that's all the time we have for questions today, and I'm going to hand it over to Peter now to close it out. But remember, you can always keep in touch with us via our social media channels, which are up on the screen right now. Keep posing questions to us there, and we will answer them to the best of our ability.
Thank you, Christine, and thank you all for joining us and for your interest in supporting our work to build lasting and equitable solutions to make California the healthiest state and to end domestic violence. We are fully committed to the success of this new strategic plan, and most importantly, the impact it will have on communities throughout California. And we know that we will only be successful if we work in partnership with each of you. The Foundation is also committed to learning what works and what doesn't work within our new strategic plan through feedback loops and monitoring our indicators. By tracking our successes and our failures, our plan will evolve as it unfolds. Today for us marks the beginning of a dialogue for change. Please note that a recording and the slides from today's presentation will be available on Blue Shield of California Foundation's website, blueshieldcafoundation.org. A follow-up email with details on how to access this information will be sent to all participants. We also encourage you to visit our website as well as sign up for our email alerts to stay informed about all things related to our new strategic plan, including grant opportunities that will be rolling out in the next few months. Thank you again for your time. We look forward to continuing to work with you. Good afternoon.